thanks so much for joining Making Healthcare Work for You, Different Perspectives and Empowering Solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta, and today we are welcomed by Gloria Lau, who is the founder and CEO of Hello Alpha. Thanks so much for being here.
Hi, everybody. Thank you for having me.
So we just had an amazing conversation, and after the interview, we were talking a little bit more, and we wanted to know about who is using Alpha. It's a primary care platform for asynchronous care designed for women, but it's not exclusively available to women. So tell us, who is your demographic? Who are you treating? Who are you seeing? Or do you get more diverse populations from people, maybe the LGBTQ plus community? Tell us, what are you seeing on your platform?
Yeah, definitely. So our platform is very, very inclusive. 90% of our patients are female or identify as female, but we do have about 10% of the population on our platform who are men. So when a man comes to our platform and seeking treatment for, let's say, asthma or mental health, right, we don't turn them away. We just never claim to be mental health expert because we're not. And when you look at who uses our platform, you do have a lot of marginalized groups. We've seen patients who are incarcerated. We see a lot of patients in more rural area. You have a lot of patients who are traditionally rejected by the healthcare system, where, hey, like I've seen lots of providers and they just don't hear me out. They don't see my pain as real, or they don't understand like PCOS, which oftentimes takes 7 years to get diagnosed, right? So you have a lot of those patient demographic where there's a lot of traditional stigma, a lot of biases from the healthcare system, and they come to our platform. A good recent example, it's the sort of like the onslaught of just like the mass of weight loss treatment or obesity treatment in general. That's a classically very high bias area where patients who are obese, right? Like you're often told that like eat less, exercise more. And for patients who are bigger, you have to worry about, are you going to fit in the check-in areas chair, right? There's a lot of worry that goes on in your head. And for those patients, we remove all of those stigma in Asynchronous, right? And regardless of who you are, what you look like, you fit the same way. You are given the same sets of clinical guidelines, same sets of medical intake forms. And you do see a very, very diverse set of patients because of that.
You never lay eyes on anybody, and obviously there's no physical exam. So what's missing? Isn't there a risk that you might be missing something?
So we do actually make a good amount of referrals to in-person clinics. We understand, right? Like when we look at conditions that we treat, we look through the lens of, hey, like whether asynchronous is the proper tool, whether we can treat you asynchronously for things like, let's say, like asthma or whatnot, right? But there are certain conditions, let's say pap smear, right? We can't do that for you. So we make referrals to these patients, oftentimes depending on where the patient is, we'll make it to your in-network providers for the in-person visits. We're also fully integrated with labs and pharmacies, and we send a lot of labs through and we read those labs as well. So we are very, very full service, but we do understand that sometimes when you need to go in person, we'll make those referrals for you and try to manage as much as we can.
Great. Thank you so much. That was enlightening. We appreciate hearing about it and learning about the new ways that people are practicing medicine. We appreciate your time.
Thank you.
More power to you. Thank you.
Thank you all for watching. We'll talk to you soon. Bye-bye.